But in the meantime, let's bring you this. Is our water safe to consume? Well, we're about to find out. Water and Sanitation Minister Senzo Mchunu is releasing the interim blue, green and no-drop watch reports. It assesses the quality of our water in terms of microbial, chemical and aesthetic tests. Now, this comes amid a cholera outbreak and questionable water sources. Let's join in now to that event.
Due to lack or weak operation and management capacities, policy inconsistencies on a range of issues, improper planning, in some cases no planning at all, misappropriation of funds in some cases, and budgetary constraints in others, and then lack of capacity. These were among the main issues that were raised by a vast majority of municipalities, saying they require attention. The Department of Water and Sanitation is responsible for planning, development and management of water resource infrastructure and for the management of catchments, as well as setting minimum norms and standards for water and sanitation ordinarily. But in our performance of these duties, we have put it to ourselves that we need to go an extra mile and go beyond the call of duty, as they say, in terms of supporting municipalities. Firstly, there are boards that are mandated to assist municipalities with potable bulk water infrastructure and services, and they are doing the best that they can do in this role. Municipalities as water service authorities are mandated to ensure that residents and industries are supplied with water and sanitation services that meet minimum norms and standards. Chapter 7 of the Constitution contains provisions applicable to local government. Section 152 outlines the objects of local government and provides, amongst others, that local government is responsible to ensure the provision of services to communities in a sustainable manner and promote a safe and healthy environment. We have several grants as the Department of Water and Sanitation that are on a yearly basis given to municipalities. One is called ARBIC, the other one is called DWISIC. They all relate to infrastructure at municipal level. But over and above that, municipalities get what is called MIC, which they get from Treasury and is supervised and monitored by local government. So these are the grants or ways of supporting local government. But as I say, we go beyond that, and we go beyond assisting municipalities via water boards. We ourselves engage directly with municipalities on water and sanitation matters where there are weaknesses and partner with them. And as of now, there's a countless number of municipalities we are partnering with. As of yesterday, we were in Tugela district municipality, where we're introducing another partnership with them on a range of projects that they couldn't on their own perform. And before that, we were partnering with Tswane in relation to the current problem that has led to the outbreak of cholera. Now, on this matter in particular, cholera outbreak, I must express our very, very deep concern as the Department of Water and Sanitation. This concern is whether our water was safe or is safe enough for human consumption. Although the source of the cholera is yet to be determined in relation to where it is broken or where it has where there is an outbreak thereof, the fact remains that cholera is a bacterial disease usually spread through contaminated water. And for that fact, we need to concern ourselves with ensuring that municipalities fulfill their obligations, that is to deliver clean, safe water and healthy environment through sanitation services. Our view is that government, or as government, we need to act together and act literally as one across all spheres and in departmental partnerships if we are to overcome our current challenges in terms of provision of water and sanitation services. We've already met with the Minister of Culture, which happened yesterday in the morning, and discussions are underway so that we strengthen water and sanitation services by municipalities. At this point, I would like to call upon Dr. Phillips to make a detailed presentation on the findings of the watch reports. Thank you very much, Dr. Phillips.
Thank you very much, Minister. Good morning. Deputy Minister, DG, members of the media, colleagues. In introduction, we are doing this work in our role as the regulator of the sector. The National Water Act and the Water Services Act together make DWS the regulator of both water resources and water services. And we developed these regulatory tools called the Green, Blue and No Drop certification programs in order to provide regulatory information regarding water services, which are largely the constitutional responsibility of municipalities. As indicated by the Minister, we first introduced these incentive-based regulation programs in 2008. Unfortunately, they were stopped from 2014, but Minister Mchunu reintroduced the programs after being appointed in late 2021. Just an introduction to explain how the domestic water cycle works and how municipal water services are related to municipal sanitation services. The cycle is that raw water is drawn from rivers and dams and treated in water treatment works by either water boards or municipalities before it is supplied to households. It is treated in the water treatment works so that it meets drinking water standards. Treated water is required by law to meet these standards, and the standards are set by the South African Bureau of Standards in South African National Standard SANS 241. Municipalities and water boards are also required to conduct regular tests on the treated water to ensure that it complies with the standard. That is a legal requirement on municipalities. After the water has been used by households, it goes through the sewer system to municipal wastewater treatment works. The wastewater treatment works remove waste from the water and then return the water to the rivers. The effluent, or what comes out of the wastewater treatment works, that goes into the rivers, is also required to meet minimum standards, and those standards are set by the Department of Water and Sanitation. The Green Drop Report is a comprehensive assessment of the state of all the wastewater treatment systems in South Africa, including municipal, Department of Public Works and private wastewater treatment systems. The Blue Drop Report is a similar assessment of the state of all drinking water systems in the country, including water treatment works and municipal water distribution systems. Both the green drop and the blue drop report cover the condition of the infrastructure, whether the capacity of the infrastructure is sufficient to deal with the demand. In other words, is the infrastructure large enough? Does it have sufficient capacity to provide what is required from it? Whether the required maintenance is being done on the infrastructure, whether the infrastructure is operated correctly, whether the proper treatment processes are followed, and whether proper monitoring and controls are in place. And finally, also, whether the staff have the necessary qualifications and skills. The no-drop report is a bit different. It's an assessment of the degree to which the drinking water distribution systems of municipalities supply water efficiently without wasting water. The no-drop assessment includes the levels of physical water losses in the system, for example, through leaks in pipes, the level of non-revenue water, in other words, water that is supplied but for which the municipality doesn't get any revenue, the amount of water used per customer per day, whether the infrastructure is being maintained properly to minimize wastage, and the existence of plans and strategies to reduce water losses. And in addition, the effectiveness of metering, billing, and revenue collection systems. So why are we doing this? What is the purpose of doing these blue, green, and no-drop reports? Our primary aim is to improve municipal drinking water quality. So it's not also only about monitoring and providing information. Our underlying motivation is to enable improvement. We want to see improvement in drinking water quality, wastewater management, as well as water conservation and demand management. The reports keep the public and stakeholders informed and updated with credible data and information about the state of water and sanitation services in the country. But importantly, the reports also recognise water services institutions that achieve compliance and excellence in providing such services. And this is why we say they are incentive-based regulatory mechanisms, because we recognise excellence through these reports, and that creates competition amongst municipalities and by officials within municipalities to try to achieve good ratings from the blue, green and no-drop reports. And that provides an incentive for water services institutions or municipalities to improve their performance. But perhaps most importantly, each of the reports identify exactly what is the cause of the problems, what needs to be done about them. In that regard, they are a support mechanism to municipalities, in addition to being a regulatory mechanism, because they provide the municipalities with advice and guidance as to how to improve their water and sanitation services. As indicated by the Minister, now that we've resuscitated these regulatory mechanisms, for each of the drop reports, because they are so extensive and because of the amount of work involved in producing a report, we only produce a full report every 2 years, and we publish an interim report in alternate years. Last year, we published the full green drop report, along with the interim blue drop report. The interim green drop report and the full blue drop reports will be released in July this year, and the full no drop report will be released in September this year. Today we are releasing the green, blue and no drop watch reports as a precursor to the releases of the reports in July. And these 3 watch reports are now available on the DWS website. What are these watch reports? Firstly, the blue drop watch report. This blue drop report that we're releasing today provides an assessment of the condition of water distribution infrastructure and drinking water quality of a sample of the drinking water supply systems in the country. The full blue drop report, which we will release in July, will cover all the drinking water supply systems in the country, not just the sample that we are providing information about today, and will also include non-technical aspects such as the skills, such as information about whether or not the municipalities have the required skills and qualifications. The No Drop Watch report is based on water conservation and demand management reports which we've received from a sample of municipalities. and we use that information to extrapolate projections regarding the extent of water losses and non-revenue water across the country. The full no-drop report that we will release in September will provide a full audited assessment of water losses and non-revenue water in all the municipalities in the country. The Green Drop Watch report that we're releasing today provides information on what has been done to address wastewater systems of water services authorities that scored less than 30% in the 2022 Green Drop report. Turning to the results in the Watch reports. Firstly, the Green Drop Watch reports. The 2022 full Green Drop report that we released in April 2022 found that 334 out of 850 municipal wastewater systems in 90 municipalities, which are water services authorities, were in a critical condition, receiving Green Drop scores of 30% and below. In other words, of the 850 municipal wastewater systems which were assessed, 334 of them were found to be in a critical state, or 39% of them, and those municipal wastewater treatment systems were in 90 different municipalities. It might sound a bit complicated, but it's important to bear in mind that many municipalities have more than one wastewater treatment system or more than one water treatment system. In 2013, when the last Green Drop assessment report was done, 248 out of 824 municipal wastewater treatment systems were in a critical condition. So when we released the Green Drop report last year, we did indicate that there had been a decline in the functionality of municipal wastewater treatment systems between 2013 and 2022. After we released the 2022 Green Drop report, we issued non-compliance notices to those 90 municipalities which had one or more municipal wastewater systems in a critical condition. These non-compliance notices requested the municipalities to submit corrective action plans to address the shortcomings identified in the Green Drop report. By March of this year, we had received corrective action plans from municipalities for 168 of the 334 wastewater systems which were found in the 22 Green Drop report to be in a critical condition. In other words, we got a 50% response rate with regard to the municipal wastewater treatment systems from municipalities with regard to our request to submit corrective action plans. About half of the municipalities asked for support from the department to develop corrective action plans, and that support was provided. Also, by March of this year, only 34 of those 168 plans submitted to the department were actually being implemented, with the balance being in planning phase or no progress reported. For those municipalities which did not submit corrective action plans, DWS has issued directives in terms of the National Water Act, compelling them to submit such plans. And we do have criminal charges and criminal action currently taking place against some municipalities where the pollution from wastewater treatment plants is particularly bad, and those include some of the municipalities which have not yet submitted corrective action plans. This slide shows the municipal progress in addressing the findings of the 2022 Green Drop report per province. It shows the number of water services authorities with systems in a critical condition which were found to have systems in a critical condition in each province. The number of wastewater treatment systems found to be in a critical condition in each province, and the number or percentage of corrective action plans received by DWS. So, for example, and some provinces are doing much better than others. So, for example, in the municipalities, the relevant municipalities in Limpopo have submitted 100% of the required corrective action plans, whereas the municipalities in KwaZulu-Natal haven't submitted any of the required corrective action plans. The full details of giving the names of the municipalities and how they've performed in this regard are in the Green Drop Watch report on our website. Turning to the findings from the Blue Drop Watch report. As I indicated earlier, the Blue Drop Watch report is based on a sample of 151 out of 1,035 water treatment systems across the country. In all the water services authorities, in other words, all the municipalities which are water services authorities, we sampled at least one water treatment system. In terms of the infrastructure condition, we found that 3% of the sampled systems were in a critical infrastructure condition, 12% of the sampled systems were in a poor infrastructural condition, 49% were in an average infrastructural condition, 31% in a good condition, and 5% in an excellent condition. And last year, the South African Institute of Civil Engineers published an infrastructure condition report called the Infrastructure Report Card, which supported these findings with regard to the state of water treatment infrastructure in municipalities. Before I go on to the rest of the Blue Drop Watch reports, which relate to the microbiological and chemical quality of the water, it's first necessary to point out that in terms of SANS 241, municipalities are required to monitor the microbiological and chemical quality of the water provided to residents at specified intervals, including hourly, daily, weekly, fortnightly, and monthly tests of various types. So you can see that there's extensive testing requirements on drinking water before it is supplied to residents of municipalities. Our findings in terms of microbiological and chemical water compliance. Firstly, I'd like to indicate how we went about coming to these findings. Our methodology was to obtain all the water quality tests carried out by the municipalities themselves during the 2021-2022 municipal financial year for the sample of water treatment systems that we sampled, and we then assessed those tests the results of those tests that we received from the municipalities. What we found is that 39% of the sampled systems achieved excellent microbiological water quality compliance, 11% achieved good microbiological water quality compliance, 9% achieved poor microbiological water quality compliance, and 41% achieved bad microbiological water compliance. In terms of chemical water quality compliance, the findings were 17% excellent, 13% good, 15% poor, and 55% bad. What do these mean? What do we mean when we say excellent, good, poor, and bad with regard to microbiological water quality and chemical water quality? We use the SANS 241 definitions, and that is that for all the tests that were looked at, and as you heard earlier, there are a lot of tests that a municipality has to do over a year. But for those tests, to get a bad rating, less than 95% of the tests must meet SANS 241 standards. To get a poor rating, between 95 and 97% of the tests must meet the SANS 241 standards. To get a good rating, between 97 and 99% of the tests must meet the 241 standards. And to get an excellent rating, more than 99% of the municipality's test results must meet the standards. So this microbiological compliance measures how well the treatment process is removing harmful bacteria and other microorganisms from the water, whereas chemical compliance measures the chemical suitability of the water for human consumption, as well as for protection of infrastructure and household equipment. Our SANS 241 is informed by World Health Organization guidelines, and those guidelines, which have been incorporated in SANS 241, indicate that at least 97% of tests for microbiological contaminants and chemical compliance conducted over a year should comply with water quality standards for the water to be considered safe to drink. In other words, our good and excellent categories. The number of samples to be tested in a specific water supply system is informed by the water safety planning requirements, which is also part of SANS 241, and that differs, for example, by factors such as the size of the water supply system. During this audit period, 11 of the municipalities that we sampled, where we sampled water treatment systems, did not provide us with the water quality data that we asked for, their test results, or provide us with any other evidence that they've been testing the water quality. We have issued non-compliance notices to those 11 municipalities, instructing them to issue an advisory notice to their residents that their water might not be safe to drink if it has not been properly tested. This map shows graphically the results of the watch report with regard to the drinking water infrastructure. So the red municipalities on the map are where their infrastructure is in a critical condition. The yellow areas are where it's in a poor condition, grey where it's in average, green where it's in a good condition, and blue where it's in an excellent condition. The details, again, of which municipalities were found to have wastewater systems in a poor and critical condition are in the watch report. This map shows the results for microbiological compliance. The red municipalities are the municipalities which got a bad rating in terms of microbiological compliance. The yellow municipalities are the ones that got a poor rating. The blue ones are the ones that got an excellent rating, and the green ones are the ones that got a good rating. Similarly, with chemical compliance, the same applies, and you can see from the map where are the municipalities which achieved excellent, good, poor, and bad ratings for chemical compliance. This slide shows microbiological compliance and chemical compliance broken down by provinces, with information on the number of water supply systems assessed per province and how many in those provinces achieved the different ratings of excellent, good, poor, and bad for microbiological and chemical compliance. Where there's an asterisk, it means it's the water treatment systems for which information was not provided. So what does all of this mean, and what are the implications of these results? Firstly, in the 2012, the last time we did a blue drop report, in 2012, that blue drop report indicated that only 10% of municipalities had bad or poor microbiological water quality. In this sample, 50% had bad or poor microbiological water quality, which indicates that there has been a deterioration in drinking water quality since the last blue drop report was done in 2012. This watch report that we're releasing today indicates that the drinking water produced from some municipal water treatment systems during the 2021-2022 municipal financial year did not meet the SANS 241 standard and could on occasion have posed a potential health risk. The report does not provide an indication of the current status of water quality in municipalities. In terms of SANS 241 and the norms and standards issued by DWS under the Water Services Act, when the tests carried out by a municipality indicate that the water supplied poses a health risk, the municipality must inform its consumers that the quality of the water that it supplies poses a health risk. We have sent directives to the municipalities which we identify in this watch report as having systems with poor or bad microbiological and or chemical compliance. These directives require the municipalities to inform their residents should they still have poor or bad compliance. To answer the question as to whether the public can safely consume their water, the answer is that they can safely consume their water if their municipalities indicate that the water being provided is being tested and does meet the requirements of SANS 241. WS Water Services Authorities or municipalities are responsible by law to inform their consumers as soon as there is any change to the quality of the water that they provide. Turning to the No Drop Watch report. The No Drop Watch report assesses the status of water losses and non-revenue water against regulatory compliance requirements and best management practices. This watch report is based on an analysis of the water balance data submitted by municipalities for their financial year ending June 2022. The report is based on a sample of 42 data sets which we received from water services authorities. We sampled 29% of the 144 water services authorities for this watch report. As I indicated earlier, we will be looking at all the municipalities for the full no-drop report, which will be issued in September. Based on what we received from the sample of municipalities, we extrapolated to produce an estimate of the water balance and non-revenue water for the country. And what we found is that the system input volume, meaning the total volume of water treated for municipal use, is approximately 4.3 million cubic meters per annum. Of that, 2 million cubic meters per annum is estimated to be non-revenue water, i.e. 46% non-revenue water. That is the volume of water that municipalities don't collect revenue for. In 2015, when the last no-drop report was published, the national non-revenue water figure was estimated to be 35%. This indicates that there's been a decline in efficiency of water use in municipalities, or in other words, an increase in non-revenue water between 2015 and 2022, from 35% in 2015 to 46% in 2022. Non-revenue water is made up of water losses and the unbilled component of authorized consumption. The international average for non-revenue water is below 30%. The national trend suggests that the per capita consumption is approximately 216 litres per capita per day, compared to the international average of 173 litres per capita per day. It is an anomaly that as a water-scarce country, our average per capita consumption of water is higher than the international average. But that is partly caused by the high level of physical losses in municipal distribution systems. And that high level of physical losses is an indication of poor operation and maintenance of infrastructure. Some municipalities have been able to reduce their non-revenue water. In order to reduce non-revenue water, municipalities need to improve the operation and maintenance of their infrastructure, to repair leaks, to improve metering, billing, revenue collection and debtor management, to improve pressure management, and to engage in community education and awareness about water conservation, amongst other measures. This slide shows the provincial data for non-revenue water. Just a couple of highlights from the slide. The Western Cape has the lowest level of non-revenue water, 29.6%, and this might be partly related to the day zero experience that occurred in the Western Cape, which resulted in much more efficient use of water by residents, particularly in Cape Town and surrounding areas, and it appears as though that culture has remained since the day zero phenomenon in the Western Cape. The highest percentage of non-revenue water is Limpopo at 56.7%. You can see that the volumes of water in Gauteng, because of our metropolitan areas, are much higher than in other provinces. Interestingly, the litres per capita per day is the highest in Gauteng. And that is something that we need to look at together with the municipalities in Gauteng and the water boards. In terms of municipal categories, the information indicates that the lowest non-revenue water is in the B2 category of municipalities, which is the large towns, and the highest non-revenue water is in the district municipalities at 57%. But the lowest water usage in terms of litres per capita per day is in the B4 municipalities, which are mostly rural, and this might have something to do that to do with the fact that many people in such areas still rely on communal taps, and they're not able to carry large amounts of water from the communal taps to their homes. As indicated previously, the highest users of water in terms of litres per capita per day are the metropolitan municipalities with 244 litres per capita per day. What are we doing to address these findings? Firstly, as the regulator, we issue non-compliance notices and directives in terms of the National Water Act to the relevant municipalities, instructing them to correct the situation. And when those notices and directives are not acted upon, we can, in terms of our regulatory role, institute legal action against the municipality. We are aware as the Department that we need to strengthen our role as the regulator. We need to become more consistent in our application of our regulatory protocols, and we are in the process of developing more comprehensive and more stringent norms and standards for water services. In terms of support, the Minister talked about the support that we're providing to municipalities. National Government is providing more than 60 billion per annum in grants and transfers to municipalities for water and sanitation services. And as indicated by the Minister, he has crisscrossed the country visiting those municipalities with severe challenges with water and sanitation services, and we are working in partnership with many of the worst performing municipalities to put in place and oversee the implementation of improvement plans. As our contribution to those improvement plans, we are prioritising such municipalities with the 12 billion in grants that we have to provide to municipalities in the form of the Regional Bulk Infrastructure Grant and the Water Services Infrastructure Grant, but we also provide technical advice and management support, both from within the Department and from our water boards, to those municipalities. Finally, these results and the ongoing deterioration of water and sanitation services at municipal level indicate that there are limits to which the support and intervention by the national government can address this decline. The root cause of the decline is poor maintenance and operation of water and sanitation infrastructure by municipalities, which must be funded from revenue from the sale of water by municipalities to customers. We are repeatedly providing municipalities with grants to repair infrastructure which is not maintained by the municipalities, which deteriorates again rapidly, and then funding needs to be provided again. So with the high levels of support and intervention that we're providing, we're slowing the decline in water and sanitation services and not arresting it or reversing it. And we are now looking at possible legislative reforms to ensure that water service providers at municipal level are professionally managed, capable, efficient and financially viable institutions that deliver water services to the required standards. And what we are going to use to inform those reforms is the existing provisions in the Water Services Act, which differentiates between water services authorities and water service providers. Municipalities as water services authorities are supposed to ensure that water services of the required standard are provided to their citizens. And here is where we think is the main area of failure, in that many water services authorities are not playing their role properly in terms of ensuring that the water service providers in the municipalities provide the water services to the required standard. So we are currently in the process of consulting with water stakeholders regarding some amendments to the Water Services Act to strengthen the role of municipalities as water services authorities and to ensure that competent water service providers are in place, and to enable the Minister to intervene more effectively as the regulator where required. The following slides I'm not going to go through in detail, but they provide the information with regards to microbiological compliance and chemical compliance per water services authority per province. So this slide shows for the Eastern Cape, for the Free State, for Gauteng. I've just highlighted in this slide because Hammanskraal has been in the media recently. I've highlighted in here that the water treatment works that was tested in Hammanskraal was the Temba Water Treatment Works, which supplies Hammanskraal for which Tshwane has issued some time ago a do not drink notice. That's the only water treatment system that we've tested that we've sampled in Tshwane. When we issue the full Blue Drop report, we will provide information on all the water systems in Tshwane and other municipalities in Gauteng. So this is the data for the water services authorities in KwaZulu-Natal, in Limpopo and in Mpumalanga in the Northwest and the Northern Cape. This information is here in the presentation. We will be releasing the presentation, but it's also in the detailed watch reports on our website. Thank you very much.
Thank you very much, DG. Ladies and gentlemen, we will now proceed to the questions. I will just ask Andile to assist with the roving mic. Just a request that just before asking your question, could you please just state your name as well as the media house which you represent, but also could I ask that you indicate to whom your question is posed. Thank you. Can I just see by a show of hands? Andile, have you noted the hands?
From IBCs. I think that municipalities have a responsibility to report to their residents if their water infrastructure is in critical conditions. I just want to know that is there some sort of mechanism that you guys have to actually track if municipalities are reporting to their citizens? Because I feel like it's quite an easy thing to do to tell citizens, but I just want to know if are municipalities complying with that sort of basic recommendation of actually informing the citizens, and if you are guys are able to check if they are. My second question is in terms of the legislative agendas that you're looking at changing. I know that there is a section 65, if I'm not mistaken, that allows the National Department of Water and Sanitation to intervene, but I think it requires that the municipality be first placed in provincial administration. Is that one of the things that you're looking at changing legislatively to make it easier for DWS to intervene in problematic municipalities? Thank you.
Thank you, Senzo. Next question.
Hi, I'm Aisha from Amabongane. My question is for DG Phillips. You noted that the Temba water purification plant was included in this interim report, but the previous Blue Drop report, the Temba water treatment works, was not categorized as critical, even though it had been issued as a no-safe drinking water area.
All right, that of course is the Q&A at the Water and Sanitation Department's press briefing just on the state of our waters in the country, whether or not they of course taking stringent measures to ensure that there is safe drinking water. That Q&A is still ongoing at the back of that presentation by the Minister and his stakeholders.